ChatGerry, the growth, transfer, and spread of cancer cells. What long-term lifestyle control really changes? Number 1523, BPT 79, the 4th of February 2026. Gerald C. EclaireMD Foundation, category cancer. Preface. After finishing my previous article on the new U.S. dietary guidelines and reflecting on my own long journey through obesity, diabetes, heart disease, kidney disease, and stroke, my thoughts naturally turned to two other diseases that worry many people: dementia and cancer. Have not been diagnosed with either, but cancer, in particular, concerns me deeply. 3 months ago, one of my female classmates passed away after her breast cancer spread to her spine. She endured severe and prolonged pain before her death. Beyond sorrow and sympathy, her suffering left a deep mark on me. It became a powerful motivation for me to study more carefully how cancer cells grow, move, and spread within the human body. This work is my response to her pain and to the many others who suffer silently in similar ways. Introduction. Cancer begins at the cellular level, the most basic level of the human body. Damage at this level is often permanent, while organs and tissues can sometimes recover. Damaged cells may not. Over many years, I have studied cancer from a systems perspective, using long-term data rather than short-term snapshots. In this article, I want to explain, in simple language, how cancer cells grow, move, and spread inside the body, and how everyday lifestyle choices quietly influence that process. Doctors often use technical words like proliferation and metastasis. I will mostly avoid those terms. My readers are ordinary people and patients, many of whom live with obesity, diabetes, high blood pressure, abnormal blood lipids, or organ damage. After more than 17 years of self-study and over 1,520 research papers, I have learned that clear language helps people understand and act. Plain language does not mean weak science. It means honest communication. What this study is, and what it is not. This is not a cancer diagnosis. I do not have tumor scans, biopsy results, or pathology reports. This article does not claim that cancer exists, has grown, or has spread in my body. Instead, this is a modeling study. Its purpose is to ask a different question. Over many years, have my body conditions become more favorable or less favorable for cancer cells to grow, enter the bloodstream, travel, and settle in other organs? In other words, in this article, I study cancer risk as an internal environment problem, not as a tumor detection problem. 3 common cancer spread paths. To make this understandable, I focus on 3 well-known cancer spread paths that doctors commonly see: colon to liver, breast to lung, breast to spine. These paths are not random. They follow blood flow, fluid movement, and physical structure. Blood from the colon flows directly to the liver. Blood from the breast passes through the lungs. The breast is also connected to the spine through slow-moving blood and fluid pathways, where cancer cells can quietly settle. The body has natural barriers that protect us: vessel walls, tissue structure, and immune defenses. When these barriers are strong, cancer cells have a harder time moving and surviving. When they weaken, movement becomes easier. Why metabolic health matters so much? Obesity, diabetes, high blood pressure, abnormal blood lipids, and poor vessel health do not directly create cancer cells, but they strongly shape the internal environment that allows cancer cells to survive and spread. High blood sugar damages vessels. Excess body weight increases inflammation and mechanical stress. High blood pressure repeatedly pushes against vessel walls, creating tiny injuries. Over time, these conditions weaken barriers that normally block cancer cell movement. Genetics and environmental pollution also matter. Together, they are often estimated to contribute about 20% to 35% of cancer risk. But lifestyle-driven metabolic conditions account for roughly 65% to 80% of cancer risk. And this part is largely under personal control. Why physical stress matters, especially in the spine. Cancer spread is not just about cells dividing. It is also about structure failing under stress. Blood pressure stresses vessels. When vessels stiffen or crack, cancer cells can attach and pass through more easily. The spine is especially vulnerable because it carries body weight every day. Standing, walking, and bending place constant load on it. If cancer weakens spinal bone, even normal movement can cause collapse, nerve damage, paralysis, or severe pain. Cancer spread is therefore both a biological and a mechanical problem. Measuring the body environment. MTPTO study this. I use a single score called metastatic transfer permissiveness, or MTP. A higher MTP means the body environment is more favorable for cancer growth and spread. A lower MTP means better protection. This score is not a diagnosis. MTP is calculated from long-term data, including body weight, fasting glucose, blood pressure, stress, food intake, and physical activity. It reflects how the body environment behaves over time. Not on any single day. MTP is the output strain I use in this analysis. Calculated as MTP equals 100 asterisk 0.2 asterisk weight over 170 plus 0.4 asterisk FPG 90 plus 0.2 asterisk BP M3 plus 0.1 asterisk food M9 plus 0.1 asterisk exercise M5. My four selected input stressors are visceral fat percentage, VF% daily pressure pulse, PPSLEP hours per night, carbs and sugar. Cancer risk builds over time. Cancer risk does not come from one bad meal or one bad week. It builds slowly. Long-lasting conditions matter far more than short-term changes. By tracking cumulative MTP energy and geometric patterns over time, I can see when cancer risk rises, stabilizes, or declines. In my case, the pattern is clear. From 2010 to 2013, I had higher weight and glucose, higher carb and sugar intake, less exercise, and weaker repair. From 2014 to 2024, sustained lifestyle changes improved metabolic control and vessel health. From 2025 to 2026, after my stroke, there may be some repair decline and glucose rise, creating a new turning point that needs attention. What my analyses show: using VMT energy analysis, carbohydrates and sugar account for 39% of total cancer-related metabolic stress. The other factors, visceral fat, blood pressure, stress, and walking activity, each contribute about 20%. This shows that diabetes control is the single most important factor. Using TDA geometric analysis, the data show a clear shift after 2014. Early years occupy a wide and stable, high-risk space. Later years collapse into a compact, stable, low-risk structure. This stability holds through 2025. Even with aging and stroke effects, these two methods tell the same story from different angles. One through the lens of physics and engineering, and the other through mathematics and geometry. Conclusion: both analyses reach the same conclusion. My long-term cancer risk has been reduced through sustained lifestyle control of obesity and diabetes, tight control of carbohydrates and sugar, along with lasting lighter body weight and visceral fat reduction. Moved my body into a more stable, low-risk state. This is not a short-term improvement. It is not a rebound or a bounce. It is the result of lifestyle control that has held for almost 2 decades. That is the message I want people to understand. Cancer risk is not only about genetics or luck. It is also about the environment we build inside our bodies, day after day. Notes behind the conclusion: the conclusion is grounded in existing cancer research rather than personal belief. Modern oncology recognizes that cancer growth and spread depend not only on genetic mutations, but also on the internal biological environment, metabolic state, inflammation, blood vessel integrity, immune defense, tissue stiffness, and the surrounding microenvironment all influence whether cancer cells can survive and move. For this reason, I focus on environmental permissiveness rather than direct causation. Obesity and diabetes are well-established modifiers of cancer risk. Large studies show that obesity increases the risk of colorectal, breast, liver, pancreatic, kidney, and endometrial cancers, while type 2 diabetes independently raises cancer incidence and mortality. Chronic high glucose, high insulin levels, and insulin resistance are known to promote tumor growth. My finding that carbohydrates and sugar, representing diabetes burden, dominate long-term energy contribution is consistent with this body of research. Cancer spread also follows anatomy and physical structure. The pathways examined here, colon to liver, breast to lung, and breast to spine, are standard clinical patterns. Research shows that vascular routes, blood flow, tissue mechanics, and bone load strongly influence spread, supporting my emphasis on vessel stress and structural weakness. Finally, cancer risk is shaped primarily by long-term exposure rather than short-term changes. The literature consistently emphasizes cumulative metabolic stress and the duration of poor control over them. Any years. This aligns directly with my research approach, which focuses on cumulative energy and long-term geometric shape change. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this summary freely. but it must not be edited or republished as your own. All intellectual property rights belong to the author, Gerald C. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and its related materials belong to the author, Gerald C.